So just as we enter our next phase of lockdown, I thought I'd give you a bit of an update from Derriford Hospital, and I'm back in this lovely rehabilitation garden that I know has meant so much to so many of our patients and our staff. First of all, I want to thank you all for your incredible efforts, not just in the hospital but across the city and our communities, for continuing to comply around keeping your hands washed, wearing your mask and importantly keeping social distance. And I think that's really paying off because our numbers are still lower in the southwest than they are in the rest of the country. But as I've said before, we're never out of the woods, and I know our numbers are beginning to rise, and they're rising quite quickly. So it's a really important time, a critical time, that we set out what our next steps are to make sure that we can keep everyone safe and supported during what I know is another really difficult time for everyone. We have already needed to make some changes to the hospital. We've had to change the use of some of our wards as we increasingly care for a growing number of COVID patients, and we're looking to change some of our other services. And I'm really sorry if you have already been disrupted and inconvenienced by some of these changes. We're having to move as quickly as we can with the information we've got at that time. But we are at a critical time, and it's really important we look ahead about what we might be facing. So clearly we know that on the current projections, the numbers are going to increase quite significantly, and we have to be prepared for that. We'll be making some immediate changes, and this includes making sure that we put some further restrictions into how you access the hospital. It's really important that we reduce our footfall here. So we will, from lockdown, be having some further restrictions in terms of the entry points, just checking the reasons why you really need to be here, and importantly making sure that you are aware of the infection control advice that will need to be in place and adhered to at all times. In terms of outpatients and your appointments, this is different to the first wave because we really want to maintain as many services as we can, but it can't be, if you like, business as usual. We do need to make some changes. So for outpatients, we're looking to increase again the number of video and non-face-to-face consultations. We're doing that with our clinical teams, and that will be to make sure that you are still kept safe and that you get the right service. But if you do need to come to hospital, please keep your appointment. We really want to care for you. But when you come, please come on your own unless you need a carer or you have any other particular needs, and do discuss that with your team here. But when you come for your appointment, and if you can, please leave the hospital again. Don't sort of spend time here because we will be restricting the amount of how people circulate around the hospital, and I'm really sorry for that, but I think it's the best way to keep everyone safe. Now, if we look at the projections, I know we're not going to be able to continue everything that we really want to do, and we will try to give you as much information up front as possible. And please accept my personal apology if you've been inconvenienced or delayed during this time. We will do our very, very best to get you back in as quickly as we can and to give you as much reassurance as we can. So finally, in the first wave, this city was amazing. It gave us such support, and the love from the city continues to keep all of our NHS staff going. This time, all I'm asking of everyone is that we really comply with wearing a mask, keep washing your hands, importantly, keep your distance, and make sure that you follow all of the guidance. That is the very, very best help you individually, your families, your communities can give to the NHS. And I think with the measures that we're putting in place, as well as sadly the additional visiting restrictions that we've had to reintroduce, will be the best help you can give us to make sure that we're there to care for you and to keep our services safe. So huge thank you from me as always for everything that you're doing, and I know I'm going to be asking a lot of you as we move forward, but we're here for you and we'll support our staff and we will emerge through this stronger. So thank you.